me when y'all see it on. All right, we're gonna give a few people a chance to get on here before we start talking. But today is gonna be the update on the virus. You got County Judge Doug Page with Richard Steptoe. He's their emergency management coordinator, and he's going to be talking to y'all. We're going to allow for questions. They're going to give a brief update, and then there'll be a question session. Please try not to ask questions that somebody else has already asked and answered, and that if it's we want to try to keep it down to where we're not confusing anybody and we're not asking the same questions over and over. So I got y'all both on. You got 135 people watching, so take off.
Good morning, Trinity County. I'm your county judge, Doug Page. We're in capacity with this pandemic we have going on with the COVID-19 virus, working as the emergency management director. At my left, maintaining his social distance, Richard Steptoe, JP for Precinct 4 / emergency management coordinator for Trinity County. And we're going to visit with y'all and try and give y'all a little information about where Trinity County is with this virus pandemic. I'll let Mr. Steptoe go into detail, but I will inform y'all we were communicated with by one of the clinics this morning, and we backed that up with Department of State Health Services. At this time, we have one confirmed case in Trinity County. One confirmed case. Like I said, I'll let Mr. Steptoe give you some details on that. I would ask, it seems that the stay-at-home order that's in place is working. I would ask that y'all adhere to that and stay at home as much as possible. If you need to get out and get groceries, go do that by all means. I don't want your families to go hungry. Get out and get your pharmacy medications as you need to. Feed your livestock. That's within the realm of being able to move around the county. But stay at home as much as possible, and just try and get this behind us and just be safe and be conscious. I understand there's been some questions about the burn ban. There is not a burn ban in place. I would ask if you do any outdoor burning, limit it to burning. I know a lot of people staying at home or cleaning their yards, and limit it to burning leaves and burning small piles of rubbish. But we're not going to be burning no huge brush piles or doing controlled burns on houses or anything of that nature. Just, like I said, limit it to small piles being burned up. And with that, I'm going to turn it over to Mr. Steptoe and let him give you a little information as far as our confirmed case and other information you may need.
Morning. There's a couple things that I want to mention, and then we'll get answering some of your questions. If I keep getting the same question, people are wanting to know, I think I have the virus, I need to be tested. The first thing you need to do is contact your primary care physician. Whenever you contact your primary care physician, he or she will instruct you, ask you certain questions. If you meet the criteria, then they will test you. The other way is, if you do not have a primary care physician, is you can contact any one of the 3 clinics in Trinity. All 3 clinics in Trinity County, the one in Groveton and the 2 clinics in Trinity, are able to test for this, but you have to meet certain criteria. The next biggest question I'm asked is, we have just had our first confirmed case as of around 1 or 2 o'clock this morning, but I've already had about 50, 60 people that are contacting me, either about calling me or messages or whatever. We have a gentleman that's approximately 72 years old in Trinity County that has been tested positive for the coronavirus. That is all that I can tell you according to state law. I can't tell you where this person, if they work. I can't tell you their residence. I can't give you that information. All the information that I can legally tell you is that a 72-year-old gentleman has tested positive in Trinity County, and that's it. You just need to interact with people responsibly, and just assume that anyone you come in contact with may have been in contact with someone else that had the virus.
Anything
That-
else?
no,
Yes,
sir.
No.
I have a question, here asking, is this disease or virus transmittable through, mosquito bites?
I do not know that. I have not read any information where that has stated that. I've been asked that question a couple of times, and I have not found an answer for that.
My understanding is, like I said, through watching the medical staff on the national level and the state level and researching it, this follows basically the same guidelines as the common flu, as far as water droplets by a sneeze or a cough or possibly touching. And like I said, it parallels flu a lot, but not to be confused with the flu.
Can you clarify church gatherings?
Church gatherings, I've fielded a couple of phone calls on that this morning. As far as most churches are a large building, I know a lot of churches in the community are doing the Zoom or some type of video conferencing and piping it in that way, and I appreciate that being done. I have allowed some churches to have their gathering of 10 or less and practice that social distancing when they're in the chapel. I know some of the churches who are doing the video conferencing, of course, you're going to have 6 or 8 people up there to put that together. And that's not a problem. I just ask that you maintain your social distancing while you're doing that.
One question came in about, is there going to be anything done to limit the amount of people going in and out of grocery stores and Dollar General stores? People seem to be concerned about too many people inside the store at one time.
That's normally being handled by the store themselves. I've seen some stores that are limiting the number of people that can go in and out, but at this time we're not. It's probably going to be up to the store. I would suggest, and depend on the size of the store, as to how many people they limit in and out. I know that in some other counties, Walmart and dollar stores and such as that are limiting the number of people, and some are not.
I got a question. Do fire, police, EMS, emergency personnel have enough PPE, including masks, soap, alcohol, and bleach, or any other projected community outbreak, for any community outbreak? So
we have a very limited supply, and some if someone has extra, I'm sure that they would appreciate the donation. We have been able to obtain some masks from a local source that donated them to one of the clinics. I know that we had an emergency meeting of the Commissioner's Court this morning. We're trying to locate some personal protective equipment.
a lot of questions are coming in about the confirmed case. There's no more information that can be given about it. You cannot know the identity. You cannot know where he lives. You can't know any of that stuff. So that information cannot be released by anybody in this room. I don't personally know it. So the people that are asking these questions, please quit asking them because we can't answer.
And I would say another one of the questions, someone wanted to know if we were tracking this individual's moves. No, we are not. We do not do that. That's whenever a doctor recommends that you go home and self-quarantine, that's what we're asking you to do. We're asking people to follow the directions. I see a lot of other people on here asking, why are people not following the directions? Why are they out milling around? I can't answer that question, but the more that the quicker we can all stay at home and not what the faster we're going to slow the spread of this disease. One other question I read, people were asking if this subject with the virus is quarantined in the hospital or in isolation. They've been quarantined at their residence. The only time if you're, from my understanding is, if you're tested positive for this virus, if you have other underlying health issues, that's usually whenever they're putting you in the hospital. But if you're a healthy individual with no underlying issues, then they are sending you home and telling you to self-quarantine.
A lot of questions still coming about the man who has it. People, you need to pretend like everybody has it at this point. You need to treat everybody as they may have been in contact with it, or they could be carrying it. That's why you need to do the social distancing. You need to stay away from people. You cannot be getting out and just mingling amongst people. It don't work that way. Just because one person has it, there's probably more cases. Stay away from people. Could law enforcement start doing some stops on the Farm and Market roads? These kids on the lake with vehicles are bored. Law enforcement right now, we are stretched to the max. We're doing everything we can. We're trying to cover all the calls. People seem to be calling a little more. So there are some calls that we're going to try to handle by phone. But if you have a neighbor that is doing something that you don't like, or their kids are doing something you don't like, or their dog, try to reach out to them and ask them to handle it first. We cannot be everywhere at all times. Again, we're limited, and we're going to limit coming in contact with some people. So if it's not an important call, and we can't handle it by the phone, and we come out, those people that are breaking the law, you need to understand that the law has changed somewhat, where a lot of these crimes are now going to be upgraded to the next level. So the seriousness of the crime is going to be enhanced. So a felony 3 may be a felony 2. So the time is going to increase the time. And I can promise you, anybody breaking the law, stealing, during this time right here is going to be dealt with swiftly. And I can assure you the district attorney is going to make sure you get twice as much time as you normally would. This is not the time to be acting foolish. This is not the time to be stealing. Of course, no time is, but right now especially is not. We're not going to tolerate it. Law enforcement is doing their job, and we're going to be very firm in how we deal with people. So anybody going to create any kind of problem, cause problems for other people or steal, you're going to be dealt with swiftly.
Had one lady asked if we could commit to updating have this type of session twice a week. I just spoke with the county judge, and he said that we would. We were initially supposed to have this yesterday. I'm glad we waited until today because we did have some additional information to push forward, and we will do that in the future if at all possible, and more if need be.
If we've already answered the question, you'll need to go back and watch the video. If you just joined us, a lot of people are asking the same question that was answered early in this broadcast. We're not under a fire ban. The judge issued the statement about that. Go back and watch it from the beginning. Here's a question. Can you lock people? If you're going to send a question, you need to make sure your typos. I can't comprehend some of the stuff that you're writing. What is the difference between staying in your residence, shelter in place, and lockdown? The order in place says stay in your residence, order number 1, but in the third to last paragraph of the order, it says that it is not ordering residents to shelter in place or be locked down. Judge, you got it.
Stay-at-home order, and what is exactly what it says. We're asking that you stay at home as much as possible. As I touched on early in this session, if you need to go out and get groceries, go get them by all means. It just asks you to get your groceries and go back to the house. You need to go get pharmaceuticals, prescription drugs, whatever the case may be. You need to go get cow feed, dog food, anything of that nature, go get it and get back to the house. A shelter in place, we discussed that in Commissioner's Court this morning. That would be more along the lines, and really I don't need to touch on it since we don't have it in place, but that would be more along the lines of if we had just something, catastrophic event happen immediately, and you had kids at school, or you had a large group at the church house, or wherever the case may be, they would shelter at that place and not stay at their house. But like I said, touching on that stay-at-home order, I just ask that everyone abide by that as much as you can. We can get this or keep this at bay somewhat in Trinity County and eradicate it if everybody will abide by the orders and stay at home as much as possible. I'm coming to the office, I'm working a little bit in the office, and I'm immediately going back home. That's the only two places I'm going in here in the last 2 weeks. And I just ask that everybody in the community and county try to abide by that order as much as possible.
I see one lady ask, does our county have a curfew? We have a curfew for anyone under 18 years of age that is not working. Kids need to stay at home as much as possible. If you go to the store and you take your children with you, you just multiplied your chance of your family possibly getting the virus by however many people you took to the store with you. If you have to go to the grocery store or the pharmacy, we're asking that just one person from the household go. This is not, this shouldn't be a time where your whole family goes grocery shopping together. Again, as far as the curfew, anyone under 18 years of age has to be at home. They can't be out by themselves. That's the only type of curfew we have at the moment.
Do you recommend wearing a homemade mask or any kind of mask? Does any kind of recommendations come out on mask?
I would say, just like the sheriff mentioned earlier, if you're going out and going somewhere, you need to take all the precautions that you possibly can to prevent yourself from getting this or bringing it back to your family or your home. If you do not have any mask and you have the homemade type mask, I know where even some clinics and hospitals are using those types of masks. So if they're going to use them, I would think that they would be more than fine for us to use.
Do we have any ideas of how many tests have been done in the county so far?
No, sir. Again, as I say, we have 3 clinics here in the county that's doing testing. We have folks, I know personally of folks that have left this county and went to another county because they live closer to the edge, or else their primary care physician is in another county. I know folks have been to Lufkin, I know folks have been to Polk County, Livingston, and folks that have been to Walker County. And it's just going to depend on where their doctors is located in their geographic region as to where they live in the county.
Could a person that survived the virus get this virus a second time?
That would be a question for a medical professional. We're not at liberty to answer that question. Talking about being tested, I would like to add, I made contact with the Department of State Health Services this morning, and our clinics, we have, like I said, 2 clinics in Trinity, 1 in Groveton. All those have been given instructions on how to document confirmed cases. Those cases need to go through the Department of State Health Services, and then I receive information back from DSHS that we do have a confirmed case in Trinity County. So we got all those protocols and guidelines in place today.
We have a question, what about local organizations? Anything set up to help those that may need assistance at this time as far as financial or food? I do know I've had a few people call me and say that they are prepared to start helping people if that does come to that. So I'm going to meet with the county judge about that later. They may have already got something in place, but we don't know of any at this time that anybody's just in a situation where they can't eat or take care of themselves. But I'll encourage anybody, if you know anybody at this time or in the near future that might have some sort of financial problems where they cannot feed their children or themselves or get medical care, reach out to the sheriff's office. I will call you or somebody will call you and we'll see what we can't do to get you some help, or the person that you know that gets some help. So please let us know that if you do. Do y'all know of anything in place at this time?
No, I do not know that we have the food trucks that are still trying to make their deliveries to the different parts of the county, such as Groveton. I think Groveton was yesterday, Ladies in Action, Wednesday. Apple Springs, and one in Trinity. And there are some other ones that are not as regular at different parts of the county. If you're unaware of that, you can probably contact the judge's office and we can try to share that information with you, or and some of your local churches, they do this as well. So if someone is having problems or difficulties with that, let us know, and we will do our best to help out anyone.
Again, when this live update is over with, it will be published to our Facebook page, so you can go back and watch the entirety, so you can see any questions that you missed, instead of us trying to repeat the same questions over and over. I'm still going through some of these questions.
I'm still looking through them. Some of these questions have been asked numerous times already. We've answered them. If you would get a chance, if you started watching us late, go back and re-watch the video. But the one I keep seeing is, I guess everyone missed the beginning. Yes, we do. Trinity County, we do have our first official confirmed case of a gentleman 72 years of age. And I can't tell you if the person works, where they've been, and we're not tracking the person. That's most of the questions.
One question was, can we do an update more often? I think we're planning on doing, how many updates we plan on doing? We're gonna start to do it twice a week. Unless something big happens and any other information comes in, then we'll certainly try to address that as soon as possible. So I'd say somewhere in the first of the week and the end of the week, we'll try to do these live updates where you can get on here and ask questions. So stay in touch with the Facebook page, the Trinity County Sheriff's Office Facebook page. We will try to update as often as we can. The Sheriff's Office itself will not comment and answer questions to do with the virus or how it's being handled. That stuff will have to go through the judge's office or through the emergency management coordinator's office. We will share what they say on our page, but we will not answer these questions. So please don't. The only thing we're going to deal with is law enforcement questions or questions like that. But as far as the virus goes, the Sheriff's Office is not going to answer those questions on Facebook. Another thing I need to address too about people that's on Facebook. Please don't send a complaint in the Facebook Messenger page to myself or to the Facebook page. We do not get those immediately. I've had people call and say, hey, my next door neighbor's getting, or not call, but get on Facebook at 2 o'clock in the morning and say they see somebody breaking into their neighbor's truck. That is not the proper way to report a crime. Call 911, call the Sheriff's Office. They are open for business, 642-1424, and they will respond. Sending a message on Facebook is not going to get a response, so please do not do that. If you want to give us a tip on Facebook, we'll be glad to accept them, as they may not be read for 24 hours. So please do not report crimes in progress through Facebook, on Messenger, or even in the comment section, because it's probably not going to be read in time for us to do anything to it. Question about you spoken with the mayors. I think the county judge is staying in close contact with the mayors at this time. You want to address anything with that?
Yes, I am staying in close contact with the mayors, and it's my understanding after reaching out to the city manager of Trinity, Stephen Jones, there were some questions about the election over there. May 2nd, supposed to be coming up, and they're going to look at postponing that. You can reach out to the Trinity city offices and get more information on that, or if I obtain any information, I will definitely push it out to y'all. But it's looking like the hospital board election and the city election for Trinity will be postponed or bumped to a later date at this time.
One thing I would like to add is I appreciate everyone sharing information the way that they do, but when we share information, let's make sure that it's factual. We don't, I saw again last night where someone shared something with me about the National Guard is coming and going to shut everything down. This is false, fake news. People, please research anything like that you get to make sure that it is truthful before you share it. If you have any question about it, you can contact me, either telephone number or social media, text, however, and I will help you verify the information before we put it out there. And because we're not wanting to scare people any more than what we have already. You just need to take the virus very seriously.
So I take it most of our questions have come to an end. If your question did not get answered, I apologize. If it's possible that it's just a repeat question, so go back and look and rewatch this video. And if it doesn't answer your questions, when we do our next live session, you can ask then, or you can also call one of these offices and get somebody to call you back. So with that being said, we're going to sign off now. Everybody be safe. Appreciate all the prayers that you sent for our officers and for the emergency personnel and for all the government that's trying to do their job. Do that. Keep us in your prayers. This is a trying time, but main thing is stay calm. With fear comes panic, and with panic comes a total loss of common sense. And a lot of this can be dealt with common sense, so keep our common sense. Just stay away from people right now, and everything is going to be okay. So
Let me add one.
Go ahead.
One thing I want to add real quickly is I do not know about the other two clinics in Trinity, but I do know that the Groveton Clinic they're even seeing patients by telemedicine, even on the weekends. So good luck to everyone.
And we'll talk to y'all soon. Y'all have a good day.